I'm Howard Frumkin. I'm the Dean of the University of Washington School of Public Health. By training, I'm a public health physician, interested both in clinical health care and also in public health and prevention at the population level. When we think about studying frogs or butterflies, we'd never dream of studying them without studying their habitat. You can't understand the health of a frog population without understanding its habitat. But it's remarkable how often when we think about human well-being and human health, we don't think about the habitat. If we focus on the built environment, on the neighborhoods and communities and metropolitan areas that are people's native habitats, we can understand very well how much habitat design, urban design, community design, influence how healthy and safe and thriving people are. Well, we know some of the things that people need to be healthy. They need to be physically active. They need to breathe clean air and drink clean water. They need to be relatively safe from injuries such as car crashes. They need to have access to green space. For all of these, we have good health data. So an intelligent city from the health point of view is a city that provides those habitat conditions that we know to be good for people. Consider transportation. We've got a car-dependent transportation system which engineers out of our daily lives some of the things that we know we need. It engineers out routine physical activity because people drive rather than walk or bike or walk to transit. Then transit involves physical activity. It fouls the air in many urban air sheds, and we know that we need clean air to be healthy. The biggest cause of death in young people in this country is the car crash, but we spend hours and hours per day in cars. An intelligent transportation system defined as, among other things, one that is healthy, also one that is sustainable and economical, but let's focus on the health part. An intelligent transportation system would have us be routinely physically active. It would reduce emissions into the air sheds, and it would reduce the risk of car crashes. By the way, those kinds of systems, sidewalks, public plazas, bicycle trails, good transit systems, do exist in some cities. They function very well. And in addition to all those health benefits, people get to mix it up with each other rather than curse each other out and shake fists through the windshields of their cars. And that is good for us as a society. We need to mix it up with each other, mingle with different kinds of people. We know that even that kind of social capital building is good for health. So an intelligent design is multidimensional. It takes as its outcomes, as its metrics of success, what we know to be our goals, in this case, health and well-being of the public. Well, as we look over the horizon, we can see some big picture trends in our cities. Number one, they're getting bigger. We are urbanizing progressively, not only as a country, but as a world. Number two, there are demographic changes, so we're becoming older, we're becoming more diverse. Both of those things have implications for the way we design our cities. So the elderly need better capacity to travel around the city without driving. That means better pedestrian infrastructure. It means mixed use, so that destinations such as libraries, schools, churches, and stores are near where people live. And that will put pressure on urban design in coming years. We know that we need to use energy differently because resource scarcities such as motor fuel will set in coming decades. So these trends converge. They give us an image of a city that is sustainable, that is navigable by people who may not have access to or the ability to use cars. And all of that's good for all of us, even though the impulses may come from different directions. Having cities with better transportation systems is a good thing for all of us. Another major opportunity is better capacity to manage information. The electronic medical record is a very important mandate in the health sector, and we're very far from being where we need to be. But imagine a day when you'll have on a chip on a card that you carry your health record. So if, God forbid, you have an accident and you end up in a hospital, or if you go see a new doctor, or if you become sick in a faraway city and you need care, your medical record will come with you. Well, at the scale of the city, that can be one of the goals of an intelligent city. And some cities have begun moving in this direction. It helps to integrate the clinics at the neighborhood level and the community hospitals and the tertiary care hospitals with a seamless flow of information about patients' medical conditions throughout the system. And that can very much be a municipal initiative. So both in terms of information flow for people's health, in terms of transportation, which is a big determinant of health, in terms of energy policy, which is health policy, we're seeing impulses for change as we move into this century, and those offer enormous opportunities for health.